Welcome everyone. I would like to present to you two cases with one of the 7 Murtagh's Masquerade in symptomatic patients with heart failure. Often, patients are referred to primary care for continuation of care after being discharged from tertiary centers. However, many of these patients may still have ongoing and ambiguous symptoms which are often a clinical conundrum. This is evidenced in both of our cases. In our first case, the patient was a 74-year-old lady who presented to a primary care clinic with reduced effort tolerance and persistent fatigue. She has a history of recurrent admissions for acute heart failure within 6 months. She did not receive any medical care for 20 years prior to the first admission. On examination, she was bradycardic, her speech and movement was sluggish. There was a subtle necklace scar mimicking neckline. When we trace back her blood investigation during the first hospital admission for decompensated heart failure, her total cholesterol was markedly deranged. Unfortunately, there was no thyroid function test. Hence, during her visit to primary care, thyroid function test was taken and it showed severe hypothyroidism. Further history revealed a history of thyroidectomy 40 years ago, in which she defaulted to follow-up and treatment. She was started on levothyroxine, and her subsequent follow-up, her symptoms improved tremendously. Moving on to the case number 2, a 83-year-old lady presented to the primary care clinic with a complaint of worsening effort tolerance and lethargy. She has underlying hypertension, ischemic heart failure with a preserved ejection fraction. On examination, her hair was thin and her skin was dry and coarse. She has no neck swelling. In contrast to case 1, she has a normal heart rate. In comparison to case 1, her blood cholesterol was suboptimized with atorvastatin 40 mg on night. She was diagnosed with Hashimoto thyroiditis and was started on levothyroxine with gradual titration. Her symptoms significantly improved. At her 6 months follow-up, her thyroid function test normalized. The main learning point from these two cases is they highlight the importance of screening for the Murtagh's masquerades, including thyroid disorder, especially hypothyroidism, as these diagnoses are commonly missed. Hypothyroidism has been estimated to exist in up to 50% of women aged 60 and above. The classical symptoms, including tiredness, physical or mental slowing, loss of hair and weight gain, are often mistakenly attributed to aging and other diagnoses such as heart failure. Therefore, a high index of suspicion with proper assessment are warranted to comprehensively manage this patient. Thank you.